Now, for the next feature of ectopic pregnancy, which we'll talk about, is we'll talk about the clinical picture of this whole condition. That's like if a patient has ectopic pregnancy, that's pregnancy that is not implanting the normal endometrium but outside the endometrium. What are the issues this patient will come and complain to you, and probably when you try to do a physical examination, what are the things you see for yourself? So the clinical picture of ectopic pregnancy, typically we look at them, right? So let's not look at the summary, but let's look at the full lecture. So first, there is so much pain in the stomach and the pelvic region. So usually 98% of cases of this ectopic pregnancy, the patient will complain about that. In fact, that would be the first thing that would make the patient come to the hospital. Then, because indeed it's a pregnancy, just that it's not a right pregnancy, the person has stopped menstruating, right? There's vaginal bleeding, adnexal tenderness or mass, shoulder tip pain. Okay, so because the nerves in the diaphragm are irritated, there can be referred pain to the shoulder side. Okay. Signs of rupture, in case there's a rupture. So there's sudden or severe abdominal pain because blood is kind of like released into the dizziness or fainting, hypotension or tachycardia, distended abdomen with guarding. If you try to touch it, the person is actually guarding it. Okay, so you do a pregnancy test, it's positive. Human coronary gonadotropin levels are actually going up. Do you understand? There's free fluid in the pelvis where you do an ultrasound. That one can actually suggest that there's a rupture. Okay, because most of the times ectopic pregnancies are accompanied by rupture.